Hello, class. I hope you guys are all doing great. I'm going to talk to you today about Chapter 8, which involves bias in service delivery from our textbook. Um, so, one of the things that we really need to keep in mind is that attitudes that we have can often unconsciously affect our behavior. And so that has kind of been shown in several different, lots of different research that's been done over the years. Teachers' expectations of classes were seen to shape the way that students performed. Differing standards of health were held for men and women. The race of the provider of the client impacts the severity of mental health diagnosis and the kinds of services provided. So all of these have to do with the impact of social, political, and racial attitudes in our society. We also experience a pretty significant underrepresentation in various professions that serve clients. Um, Doctoral psychology programs, enrollment rates are less than 5% for students of color. And those numbers have remained consistently low. Numbers for faculty of color are also disproportionately low across the United States. There has also been a pretty significant underrepresentation among providers of color as well. And so there has never been a Hispanic American, Asian American, or Native American that has been elected president of the American Counseling Association or the American Psychological Association. Only one African American president has ever been elected president of the American Psychological Association. And none of the five most commonly used textbooks and counselor training programs in the US list racism as an area of attention. So again, there's a pretty significant underrepresentation of individuals of color and just a underrepresentation of and lack of awareness of the issue within the profession. Also within the profession, we have biases in assessments that are done. So patients of color tend to be over pathologized by personality measurement tools, and sometimes they have their intellectual abilities underestimated by intelligence testings as well. So there's oftentimes biases in assessments as well. Some barriers include language differences between testers and clients, test items and procedures that reflect dominant values or are not standardized to populations of color, as well as differences in experience taking tests. That's a pretty significant difference in an assessment as well. There's also biases in diagnoses that individuals of color experience. And so there's a difference in how problems are reported and how help is sought culturally. The nature and configuration of symptoms can be understood and interpreted differently depending on your race or your ethnicity. How problems are traditionally solved is very different in how we understand diagnoses among different races. How the origin of presenting problems is understood and what appropriate interventions involve can vary depending on an individual's race. Cultural attitudes towards mental health. So mental health can be a very taboo topic in many different cultures. Attitudes towards mental health vary with regard to appropriate personality dynamics, definitions of therapy, and how help is sought. This varies pretty significantly in various cultures. So the textbook talks about a Chinese American example. So mental illness is seen as a loss of discipline, a preoccupation with morbid thoughts, insecurity due to absence of social support and distress from external factors. When oftentimes mental health is the opposite of these traits. So, externalization of blame for mental illness and preference for authoritarian, directive, fatherly helpers with regard to mental illness. So, that is oftentimes, again, a very cultural difference with mental health. So, conceptions of mental illness constructed and influenced by cultural beliefs. So this globalization of treatment modalities. So there's very different um, treatment modalities for various mental health um, issues depending on the culture. So, for example, the textbook Waters 2010 offers 4 cultural examples of the spread of Western descriptions and categorizations of mental illness: anorexia in Hong Kong, China, PTSD in Sri Lanka, schizophrenia in Zanzibar, and depression in Japan. So all of those look very differently depending on the culture. So suicide is another example of very significant differences depending on your race. And so the highest rates of suicide are found among Native Americans, whereas African Americans and Latinos experience the lowest rates of suicide. European American males experience suicide rates 3 times higher than European American women, and occurs most frequently with those over 50. So you're seeing a difference in race, and then also differences in gender. In communities of color, suicide occurs most frequently in young men, whereas European American, it's males over 50. The next highest is among European Americans, followed by Chinese Americans and Japanese Americans. And then we have extremely low suicide rates in African American, Native American, and Latino women. So again, suicide, which is also oftentimes seen from a mental health perspective as depression, isolation, some kind of mental health disorder, varies depending on the culture. So basically what we have seen unfold is that mental health professionals have introduced bias and cultural insensitivity into their work with culturally diverse clients. Ethnic populations have been regularly viewed pathologically, and cultural differences. The therapeutic alliance is oftentimes weakened or terminated when clients of color perceive white therapists as biased, prejudiced, or unlikely to understand them as a racial cultural being. So, talking about racial and cultural diversity is of utmost importance when working with clients, and really recognizing and understanding their experiences and where they come from culturally is very important when we're talking about mental health. I hope you guys have a great week. That's just a quick overview of Chapter 8. You'll get a lot more information from the textbook. This week, your assigned reading is Chapter 8 and Chapter 9, as well as some extra readings that are available to you on Blackboard. So I hope you guys have a great week, and thank you so much.